Hi, friends. Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. I'm ineligible. I have talked to two people over the last 2 days who told me a story about how one has an Guillain-Barré syndrome she's had since childhood. Not sure where it came from, but Guillain-Barré is a neurological disorder. It became very prevalent in the 1970s with the swine flu vaccine, and that brings up the second person I talked to in the last 2 days that got Guillain-Barré from the swine flu vaccine. A friend of mine that I went to chiropractic college with, her father was afflicted with Guillain-Barré and was in a wheelchair for the rest of his life after getting the swine flu vaccine. If you're one of those people that has had past adverse reactions to vaccine, you are likely ineligible for future vaccines because of the possibility of a hyperimmune response or the possibility of neurological sequela or outcomes. Um, or if you have a genetic malfunction, it's a genetic mutation called the MTHFR, which means that your body does not break down the components of a vaccine effectively enough and creates long-term cognitive, meaning thinking process issues with you. You are ineligible. You don't need to ask the question again or pose the question again. Your response is somebody saying you, harassing you, are you getting the vaccine, which I call the reformat. The COVID vaccine is a reformat. You can say no, I'm ineligible. Something else I wanted to discuss today. This is a recent interview I heard on the Reuben Report, which is a YouTube channel, Reuben Report, and he is the man that also started locals.com. If you haven't done so already, please subscribe to my channel by hitting that subscribe button below. Hit that little bell so you get notified when I do new videos. And also, if I suddenly disappear from this platform, meaning YouTube, look for me on locals.com. So this Reuben Report interview with Senator Paul, with Rand Paul, sorry, it was posted 5 days ago, and I just happened to see it on my feed today, and I loved it. However you might be politically or whatever you think, it was a straight shooting, just 5-minute segment where they were talking about the reformat. And I wanted to share some of these things with you because it totally made sense. Senator Paul said he said I'm not getting the vaccine again because I've been vaccinated. I had COVID, and that is a brilliant statement to make because he has the best kind of immunity. He's got natural immunity. He had the disease, he recovered, his immune system has a memory of that. And he mentioned that 30 million Americans have had COVID and only a handful have gotten it twice. And you may know some people. I know somebody that had it twice. But those people that got it the second time, there is zero incidence of severe hospitalization, of a severe case of it, zero incidence, 0% chance that they died. Nobody died when they got it twice. So this is huge. This is something to think about. If you've already had COVID, you probably don't need to get the vaccine. Then you don't need to worry about. So there's another response for you when somebody harasses you about getting it. Hey, I already had it. I have the best kind of immunity possible. I've got my natural inborn immunity. And I use the word harass because that's the word that Senator Paul used. He said that Fauci in the hallways of the Capitol building every day is questioning him. Are you getting the vaccine? And he's getting a little ticked off. And I don't blame him because he said Fauci only wants him to get the vaccine as an example. And that is the worst possible reason to disrupt your own physiology, disrupt your own body, make a choice about your own health care that you don't want to make because you're being an example. So he says that it's a noble lie. He said Fauci wants him to get the vaccine to be an example. That is a noble lie. It is not for Senator Rand's own well-being since he's already had COVID. And he talks about being an example, getting it just to conform, getting it just to submit is against our rights as individuals, having purview over our own health and having the power and knowledge to have our own choices, to make our own healthcare choices, whether it's conventional medical care or whatever we want to do. And he went on to say, making a choice just to be an example out of submission, out of conformity because of harassment is not science, is not. He did also say, and I agree with this, and I told you this on my last video about excuses you could use. My title of that video was, But Everybody's Doing It. Not me. That was the title. He says, if you're unsure, if you're on the fence, just wait it out. And that is one of the things that I mentioned last time. Give it 2 years, give it 2 months. Just wait to see how things fall out because the world is coming back to normal whether you've had COVID or not. If you are somebody that's over 80 years old, who is the highest risk factor to have severe reactions to a COVID infection, you may want to take the vaccine. And that was also mentioned by Dr. Simone Gold in her talk about the vaccine, that in that age group, because that age group has the highest incidence of adverse reaction, you may want to take it so your body has a boost of immunity right away. But for the rest of us that have a longer time here on earth, for the rest of us who the incidence of dying from it are 1% or less, we need to take a step back. So I give you permission to say, I'm ineligible. I give you permission to say, I'm just going to give it some time. I give you permission to say, I had it. I've got the best immunity possible. So, as always, putting the knowledge and power of your health back in your hands. Bye for now.